The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are here for the next episode of TMD Demystified. My name is Tony Urbanek. Welcome. I appreciate you viewing this episode, and hopefully you can learn something that you can use in your practice for the benefit of your patients. Today's episode and title of the episode is, Why is TMD, TMJ not covered by insurance? Now, if you have ever treated a TMD patient, you may have heard that comment from one of your patients. It is very common around here. It is the second most common question that the patients ask who are under treatment for this devastating disease. Why isn't as they call it, TMJ, covered by insurance? The most common question is, how come nobody ever told me about this before? Meaning the success rate that they've had by using our device and protocol. That's the most common question we get. The second one is, how come insurance doesn't cover this? So we're going to unpack that, as they say. We're going to talk about it a little bit. Hopefully I won't bore you with it, but it's very interesting information. It's very interesting to look at it from a truthful point of view, because, well, I don't want to get too deep in the weeds, but there has been a lot of smoke and mirrors regarding TMD, TMJ for the past 70 years. Now, the majority of that smoke and mirrors actually comes from the clinical side, but a huge amount of smoke and mirrors comes from the, quote, insurance side. So let me take you through the logical progression of this information and see if it doesn't make sense to you, because my job is to simply make sense about this problem. Clinically, I've discovered the actual pathophysiology of what creates the symptoms of TMD, how these symptoms are created because of chronic inflammation in the joint, chronic inflammation in the temporomandibular joint, or in the knee, or in the elbow, causes muscles to get tight, pull on the bone, stimulate the nociceptors, and create pain at the insertion or origin of the periosteum of that muscle. That's the actual pathophysiology of temporomandibular joint disease. It's the pathophysiology of tennis elbow, and pathophysiology that is attached to any of the joints in the body. But we're getting off track. We're going to talk about why TMJ is not covered by insurance. So let's first of all define insurance, because if you argue with me, you have to define your terms. Insurance, this is right out of the dictionary. Insurance is a practice or arrangement by which a company or government agency provides a guarantee of compensation for specified loss, damage, illness, or death in return for payment of a premium. That's very concise and I think very complete. Good definition of what insurance is. So if we're going to talk about why it isn't covered by insurance, we have to first define what insurance is. So there is a huge difference between medical insurance and dental insurance. I spoke on this in several episodes at times. This particular episode is drawing all of this information together at the same time to answer this critical question, why it's not covered by insurance. But it has several parts I want to explain, and I have explained in prior episodes. First of all, medical insurance can be qualified. It suits the definition that I just gave you. Medical insurance actually guarantees compensation if you pay the premium. Now, every medical policy is written in a little different way, and what they guarantee is specified in the policy. But just like car insurance or home insurance or life insurance, depending on how the policy is written, it guarantees that if you meet the qualifications of the policy, they guarantee they're going to cut you a check. If you have car insurance and you have a $60,000 car, and unfortunately you have an accident and it totals that car, fortunately you're not injured, and you total a car, then your insurance policy guarantees that it will replace that car up to the level that they promise in the policy itself. In most of the cases, they will replace that car at the current level of the value of that car. And that's insurance. Now, medical insurance, they guarantee that if you have certain types of illnesses or problems, that they guarantee reimbursement, especially if you have a catastrophic injury or illness. You are likely to get reimbursement much greater than the premiums. Going back to the car insurance, your premium may be $100 a month, $1,200 a year, but if you have a $60,000 car that's valued at $60,000, you're going to get a check for $60,000, which is high, much more, greater than the $1,200 a year that you pay in premium. Same thing with medical insurance, catastrophic coverage. If you have a catastrophic illness, for example, a cancer, and you have to go through months and months of radiation therapy and chemotherapy, and your bills mount up to a couple $100,000, but your premium that you paid for that medical insurance may only be, in current numbers, roughly $500 a month. So over a period of a year, you pay $6,000, but you get reimbursed for your medical problems, $200,000. Now, that's medical insurance. Dental insurance is not insurance. Dental insurance is not consistent with the definition of insurance. So first of all, you got smoke and mirrors with the dental insurance plans. Dental insurance should be called dental plans. They should leave the word insurance out of it because it doesn't jive with the definition of insurance. But a dental plan, basically, either you individually or your company, more likely, has coverage for you for dental problems at which they pay a premium. And if they pay a premium of, let's say, $3,000 a year, the plan basically will reimburse dental providers $2,000 of that $3,000, and they keep $1,000 for themselves. And those are fairly close to the actual numbers over the different dental kinds of plans, quote, insurance plans that are out there. About 2/3 goes to the dental providers, that is you listening to this episode, and 1/3 of it goes to the dental plan, of which they pay their salaries and any expenses that they have. And of course, and as we witnessed recently, very recently of this date, dental medical insurance in both dental and dental plans, their job is to collect premiums and to pay out as little as possible. That is their job. And that is why they frequently what they both have in common between medical insurance and dental plans is they spend a lot of effort and a lot of time denying or arguing with providers, saying that it is not warranted to do such and such treatment. And that's the only thing that is similar between a dental plan and dental insurance, is that both types of companies spend considerable amount of effort, time, and planning on denying or delaying their coverage. And we have learned that recently as of this date, which is December the 17th, 2024. And we all kind of agree on that, whether you are a patient or a healthcare provider. We've all experienced that on a daily basis. So let's get down to the nitty-gritty, the meat of why is TMD, TMJ not covered by insurance. So we have two types of, quote, coverage for our bodies. There's the medical insurance that covers the things that are considered medical, and then there's dental plans, not insurance, that covers things that are considered dental. Well, this joint, let's start out here. This joint was taught to you in dental school as a conundrum, a complicated joint that's very unique, very different than any other joint in the body. And that was the big lie. It actually was a lie. It's not more than a misunderstood, because even though you're not based deeply in the sciences, it just stands to reason. It's common sense that any joint in the body would operate in a similar manner. The creator, whatever your definition of that would be, the creator of our bodies would not single out one joint and have it operate totally different than any other joint in the body. Of course, it's in a different place. Of course, it's in our head, and it is the joint of the lower jaw. And there's a lot of things about it that we can discuss anatomically and physiologically. I am an anatomist with degrees in cell biology and gross anatomy, but I don't need to go there deeply. I don't want to go there deeply. The big lie was this joint is different. So different, doctor. You'll never understand it. It's complicated, doctor. And that's the justification that the dental industry, the dental profession used is not coming up with a solution, a reasonable, easy, relatively predictable, highly successful reason why they couldn't come up with a solution for temporomandibular joint problems until recently, of which, if you want to know the solution, just continue reading earlier episodes on TMD Demystified. So we had this joint was considered unique from the dental profession. It was given to the dental profession by the medical profession, specifically the orthopedic surgeons who deal with all the other joints in the body, but they didn't want anything to do with the temporomandibular joint because it's connected to the jaw, which is connected to the teeth, and they don't want anything to do with teeth. They don't know anything about teeth. You have to go to dental school to know something about teeth. And so in the natural order of things, starting more than 90 years ago, orthopedic surgeons didn't want anything to do with the temporomandibular joint. The ENT doctors, for the same reasons, didn't want anything to do with the temporomandibular joint because they knew that this joint and jaw was related to the teeth, and that is why the maxillofacial surgeons jumped into that void and became the surgeons of the maxillofacial region, specifically the hard tissues of the face and associated structures. And as an oral maxillofacial surgeon, I have to say we got pretty good at doing that. But this joint is actually a medical joint. That is point one I want to make. It is a medical joint, just like any other joint in the body. When I did temporomandibular joint surgery in my career for 36 years until I decided temporomandibular joint surgery was not going to be the long-term solution, there must be a better way. And that was approximately 14 years ago when I stopped doing temporomandibular joint surgery after 36 years and 2,000 cases of temporomandibular joint surgery, half of them open joint surgery and half of them through an arthroscope. And my experience was 30% of the people or more would be back in my office within a year or two with the same symptoms. So I was not happy with the long-term output and experience with TMJ surgery. But when I did temporomandibular joint surgery, if there was going to be insurance coverage, it was always covered by medical insurance, unless the medical policy for this particular patient had a specific disclaimer, exclusion, that it did not cover temporomandibular joints. And back in the 80s and the 90s, there were several insurance companies that had specific exclusions for temporomandibular joint surgery. So it was not covered by their particular policies, but generally speaking, most policies, the bigger companies for sure, covered temporomandibular joint treatment for surgery only, and still do to a great extent. But because it was treated by dentists, whether you're single degree or double degree, you're considered a dentist. Because it was considered by dentists, it was not going to be covered by medical insurance unless it was a regular policy. Now, the dental plans did not cover temporomandibular joint surgery. They did not have anything to do with temporomandibular joint surgery. They would cover night guards, which don't have any effect on temporomandibular joint problems, and which is the, quote, the standard of care. Even today, the standard of care in the dental profession is to make a night guard, give it to the patient, and then hope the patient doesn't come back to your office, because they will with the same patients if they just use a night guard. Doesn't treat TMD. But dental insurance thinks that the treatment of TMD, they want to call it a medical problem because it was covered by insurance, medical insurance, if it wasn't totally excluded. And the medical insurance companies, they want to call it dental. And on top of that, for years, the medical insurance argued with the maxillofacial surgeons that it was experimental. And I think any particular surgery, any particular surgery, as we increase our technology, whether you're doing, open belly surgery or you do it through a scope. There's so many procedures that are done through a scope. The same thing applies to many of these other types of surgery as we increase our technology. The medical insurance did their very best to claim that some of these new technologies were experimental. So I experienced that also. But the point is very simple. The medical insurance wants to tell the healthcare providers that this is a dental problem, and the dental plans want to tell the healthcare providers, in this case, us dentists, that there's a medical problem, and that because of that issue, there is no agreement on who should be paying for it, and each type of policy, dental or medical, points the finger at the opposite and say those are the people that should be covering TMD coverage, and they get away with it.